remove tonsil stones without surgery with 4 easy ways. Oftentimes, when we notice that we have little white nuggets in our tonsils, we feel as if something is stuck in our throat. These white nuggets are known as tonsil stones, and a lot of people who have them aren't aware that they have them. What is the reason for tonsil stones? They develop when bacteria, mucus, dead skin cells, and leftover food particles begin to deposit in the tonsil crypts. They can be whitish or yellowish, and their texture is soft and squishy. These stones can lead to bad breath, throat irritation, and difficulty swallowing food, and even breathing problems. Who is prone to tonsil stones? If you suffer from chronic inflammation of the tonsils, if your tonsils are too big, or if you don't practice good oral hygiene, the risk of tonsil stones is much higher. The conventional treatment for tonsil stones is a tonsillectomy or surgical removal of the tonsils. However, this doesn't guarantee that the tonsil stones won't reoccur. Moreover, when you eliminate the tonsils, you actually remove a part of the immunity which is needed to prevent bacteria and viruses from entering the body. Other ways to remove tonsil stones. Besides surgery, there are other less invasive methods of removal that you can perform at the comfort of your own home. Let's take a look at some of them. Q-tips. If the Q-tip is big and visible enough so that you can reach the back of your throat, you can easily remove the tonsil stones. Gently push the visible area of the tonsils with the Q-tip until they're dislodged. Do this in front of a mirror. When you apply enough pressure, the stones should pop out from online pharmacy reviews safe behind the tonsil pockets. Dental irrigation syringes. To flush the stones out from the tonsils, purpose the sinusoidal tip of the syringe directly at the pockets within the tonsils affected with the stones. Not like Q-tips, these syringes can assist you take away the stones that square measure deeper within the tonsils and don't seem to be visible. Make certain to stay the top down so the stones fall out of the mouth. The mixture within the syringe ought to be comprised from equal components of 3-oxide and heat water. Oxide can ease the removal of the stones since it creates associated setting wherever microorganism cannot thrive. Oral irrigator. This water flosser has a motor, water reservoir, and a specialized water flosser nozzle. It's a method for flossing with water instead of with a string. To remove tonsil stones, position the nozzle directly at the tonsil crevices and blast them out. Make sure you don't hurt the tonsils by being over-aggressive. Set the irrigator on the lowest setting. Oral probiotics. These strains of fine bacterium have the facility to suffocate the dangerous bacterium within the mouth that square measure inflicting the tonsilous stones. The foremost effective probiotic against tonsilous stones is asp. Salivarius K12. Take a probiotic capsule, open it, and blend the content within with 4 oz of heat water and stir the mixture till the capsule content is totally dissolved within the water. Swish the answer within the mouth, that is near the tonsilous stone space. To realize this, tilt the pinnacle back to a small degree before projection the answer out. Change of state. Gums and toothpastes can even be terribly useful within the removal of tonsilous stones. Yet,